Hello all, I am Dr. Neha. I am a consulting physiotherapist. I am working in this field since 12 years and I am working in my own clinic Physio for you, which is there in Pune since 8 years. Now we run physio awareness program in nearby areas in which we give consultations, we give lectures, then there are exercise programs and many people are getting benefited from it. So as this is the 8th year of our clinic, me and my team have decided to just go one step further and to reach as many people as we can. So for this we are starting with our channel Physio for you so that many people will get benefited from it. Now in that channel we will be discussing many conditions which we deal in our clinic. So what we have realized when we practice in our clinic is that many people don't have idea or awareness about the conditions. They have many doubts and they are not aware about many techniques also how physio can help them to reduce the pain and increase the mobility. So we will be discussing each condition in each video so that you will get an idea about how means you can relate your pain, your difficulty in movement to it. So you will understand where you stand in that condition and what help you can take from the nearby physio or you can approach to our clinic also. Now please keep in mind that this will be the general idea as we will not be doing the individual diagnosis here. But yes, you will surely get a proper guidance about the conditions and how to go for the physiotherapy treatment about it. Now what conditions we will be discussing are the women's health we will be discussing, then these are the work related musculoskeletal disorders. Now in women's health there is a pelvic incontinence, that is urinary incontinence we say, core instability, then the posture when they work in the kitchen and all. So we will be discussing about that. Then the work related musculoskeletal disorders and the people who work in IT, they do get neck pain, they do have the back problems and also we will be discussing on that. Then there are degenerative conditions like cervical spondylosis, lumbar spondylosis, osteoarthritis. So there are many ways we can treat it other than just the electrotherapy and medication. So we will be discussing on that also. Then over injuries like tennis elbow, then tendinitis. So even that you will get help about it. Then sports injuries and rehabilitations like ankle sprain, ACL, ligament injuries, MCL, meniscal tears. So we will be discussing about that. Then post-immobilization or post-operative treatment of fractures. Many time people they get confused about how to go for the physiotherapy after the fractures or after the immobilization, as they have lots of stiffness after the immobilization. And after the operation also they don't know how to go for the exercise protocol. So we can guide it about it. Then geriatric population. Then gait, balance and coordination. After the surgery, mainly about the limbs, that lower limbs. People do feel balance, inappropriate balance, they don't find the coordination while walking, there is change in the gait. So we will be discussing about that also. So what I will suggest you is to please subscribe to the channel so that you will not miss any of this video and you can help your family members, your friends through it. Thank you so much.